Well, greetings again. This is Dr. Bill Wyatt, and I'm here with the American Orthodontic Society. And we, in the American Orthodontic Society, believe that there are many untruths floating around in orthodontics that ought to be done away with, that you can do most anything within reason with the teeth. You can move them backwards and forwards. You can expand them laterally. You can pull one of them from the back to the front and just come right through knife edge ridges of bone, and you'll be told that you couldn't move a tooth through a knife edge bone area, and you can do it, and you can expand the upper arch on any adult. I don't care who you are or where, and you can do that. And so don't believe what you may have been taught. And it's hard to somebody that knows or thinks they know the right thing, and you try to teach them, and they just will not give up this problem that they have. But you can expand this. Now, this case right here that I'm going to show is really a complicated mess, and you can do that, and you can, let me see if I've got this deal going here. All right, there's several things over here. I'm not going to spend a lot of time on that, but I'm going to just show you what we did. Difficult case. It wasn't made easy, but it could be done. Now, this is a guy, I got to know him real well. I mean, he came in, we had a problem. I mean, he's been chewing like that all of his life. And a man with a problem like that. And people said, well, you can't do anything with him except extract the teeth and put dentures in. And that's a bunch of bull. You can move these teeth all over the place if you want to. If you just take time and effort to go in there to do that. Now watch the guy open and close his mouth. And he opens his mouth, he opens it almost a half inch in here space to get these teeth up here. When he closes, his lower teeth are up here. Please, we'll go down there again. See where you can hardly see his upper teeth. Now he's up like that. And there's several things in this case. Everybody doing orthodontics ought to know you can do these things. If they don't want to do it, okay. But if they've got guts enough and brains enough to do it, let them do it. Don't go in there condemning them. If they're out where there's nothing else can be done, let them do it. And it's going to be orthodontics running out our ears. I mean, the orthodontists wonder we're going to have anything to do. There'll be more than you can possibly do. So people all over the world, they have money now, and they want to do it. They want to fix it up, and you can do it. Now watch this guy. We had to get these teeth down here, right here. So I put something up here to bite down on. So now you're taking a chance with a temporomandibular joint. You move this jaw forward, you move this jaw back, you get the condyle back too close to the retrodiscal tissue, you might have some problem. But I had no problem with this fellow. I got to know him so good doing this thing. And let me show you what we did. we put a bite plate in the anterior part of the mouth. And I'm not pulling your leg. These teeth moved together. These went up and those went down. And these teeth were forced up some and forced down some over here, and the thing leveled out. And while I was doing that, I expanded the upper teeth. We put a large wire in there and expanded that. Use your buccal root torque and a big arch wire, and you would expand anything walking and breathing that's alive. It does, and that is true. And you can carry the tooth bodily out, but you've got to have a rectangular wire with buccal root torque, and you expand with a big wire, you put positive crown torque, and you want the tooth to move out bodily like that. Don't go out this way because the roots go back the other direction. Now, so we're going to expand this guy's upper arch. And I was told, I don't know how many times, and people write back and say, I go to the orthodontist and he tells me, well, you're too old, your teeth won't move in the bone, and this is a big lie. I'm going to go ahead and call it a lie rather than an untruth. They can be done, and you can do it. And so this is why I think that if you're a pediatric dentist and you neglect doing orthodontics or learning orthodontics, tell the orthodontist to go to heck. You're going to do it anyway. They're not going to take it right away from you. And so every pediatric dentist ought to be doing little bits of orthodontics along the way. You ought to learn how to do it. And I have spoken to groups of pediatric dentists for years, and still the Pediatric Society is under the thumb of the orthodontist. They won't even let our group come and try to teach orthodontics to their group. They are just afraid in the universities. We ought to go to the universities and tell them what ought to be done. And if they don't do it, go to the person supporting that dental school and let them know. Now they're coming out with schools to teach people orthodontics, and you've got $500,000, and you can go there in 4 years in that dental school. They'll go through everything they say. They don't even give them a board when they get through. You don't know who knows how to do what in there. But you can expand the cuspids here. So I'm going to run through this case real quick. And now the teeth are almost flat now. So something has happened. They didn't get bigger. They moved down. These teeth moved down. These teeth moved up. These teeth here had the pressure on them. They moved up. These teeth moved down. And the thing levels out. I don't give a hoot who you are, and you think that won't happen, but it'll happen every time. That is a truth. And that'll be true as long as human beings are like they are. And that it'll be a truth. I don't have much time left here to try to convince people that these things are there and they can be done. And now look at what we did here. We leveled them out, then I expanded the gaps. He had to have some bridge work done in there. Let me go here real fast. If you need this, I've got this on another video that takes the details out of it. Okay, we bite down on that pad in the front part of the mouth, Now, if it's jaw joints that give trouble, you'd have to go back and put a pad on the molars back in here, and you put pressure on that and let the teeth come down. It will take a little longer to do it. So the teeth are there now. These teeth and these together have moved almost, these lower teeth went up to here somewhere. And that is moved, and I tended to, it is a fact. This bone structure that people have can be moved and changed as long as we are living, and that is a fact. And that'll be write it down if you want to. All right, the teeth are worn down. We brought them up like that, let them come in contact. And then he went to another dentist who does restorative work, and he put some bridges in for this guy. So we're expanding the upper arch with this big wire here, and we're expanding this gap with this spring on an arch wire that's underneath there. It's expanding that. And his teeth moves, his bone moves. The teeth can be turned around. You can move one from the front to the back, or you can go from the back to the front. And here he is. I'm going to call him R. J. He and I got to be good friends. I worked for him. He went to another dentist and had some bridges built. He came back griping about the cost of the bridges. Actually, there are people in the world today that are running around, got money running out their ears, and they'll pay you big prices. Here are his teeth now. We were told that you cannot do this, and you can do it. I've got hundreds of adults that we have expanded, but nobody quite as big as RL here. Got those beats like that. Now they're out there. Now here is the man you're looking at. This guy right here is a different person. He can go get a job. He could smile and talk to people. He could go on the radio. He could go on the TV. And he is a handsome, really old boy. And really, I am so proud of him. See, that, yes, why, how in the devil have I lived here to 96 because of people like this? It made me feel good about life. And if you want to learn to enjoy life and look at the positive side of it and do things for people like this, it makes you feel good. And feeling good is an important thing. And so this guy, he is smiling now, and he had to pay a little bit for these crowns to go in there, but I did the orthodontics for about what it would normally cost. And nowadays, if you wanted to charge somebody $25,000, $30,000, they'd be tickled to death if they thought they could have their teeth restored to something like that without having dentures or partials or a lot of stuff done. Implants and bridges are great if you have to have them, but this is something we ought to think and take into consideration. And he's got a smile there, and it puts a smile on me to think of, and I was able to help him to this point. So thank you for watching, and I hope you'll pass on the information to people around you. Don't hide something you know can help people all over the world. Can be helped by doing restorative dentistry through orthodontics. It's far, far better and far, far more reasonable to do it. So thank you for tuning in. And I don't have much time on this earth left, but I am glad I've been here, and I want to leave a few tracks behind for people to follow. Thank you for watching. And in the American Orthodontic Society, if you want to know how to do this, our headquarters are in Grapevine, Texas, and we'll teach you to do this. Thank you very much for watching, and I'm going to close out. And there's the x-rays are high. He closed when we started. There's where it came to. We opened that up. I am ashamed that I didn't move this tooth up here. I could have done that. So we bridged that at that point. I thought we were through with this. It was that way when we started. Now he's like that. Okay, I think we've seen enough of this. Thank you for watching, and share this information with everybody you know of. And if you don't have somebody that you can go to and do some of this stuff, take the blooming video and show them so that they